on to the next question. I think this is going to be our last question for this evening. Thank you so much. That went by really quickly. Thank you. Um, so the question goes as so: my baby's blood sugar was low after birth, and the doctor said he needed monitoring. Is this dangerous? And what causes low blood sugar in newborns?
Sure. So this is one of a very common condition that we see in the newborn period. But there are certain risk factors within maternal history that we anticipate that these babies can have hypoglycemia or low blood pressure, blood glucose levels. So in these scenarios, so typically, like if mom is, we call it gestational diabetes. So if mother has diabetes during pregnancy, whether it be like diet controlled or medication controlled, or sometimes insulin dependent diabetic mothers. So the babies that are born to these moms can have low blood glucose. And within the first 2 days, it is okay to have like a borderline blood pressure, but blood glucose. But after that, it needs very close monitoring. Sometimes it needs supplementing the breast milk with additional calories. Using Sometimes we use starch to add more calories, or babies may need IV supplementation of dextrose or glucose that will help keep them within a normal range. The concern is that whenever there is like very low blood glucose levels, we worry about neurodevelopmental outcome, because low sugar is a good fuel of energy for the brain, right? So if you have very low blood glucose in the newborn period, there may be problems with neurodevelopmental outcomes. That is why we worry about it. If it is persistent, it needs an endocrinology consult, because as you know, it is controlled by the hormones, by the pancreas, by all the stress hormones in the body. So that means those things are not triggered well, or the pancreas is not functioning well. So we do get like the endocrine consult after doing what is called critical labs. So the critical labs are like how to recognize hormonal problems in the baby. So as you know, the birth is a stressful condition, and the hormone should be responding in a certain manner. If they're not, then you come across problems like temperature, glucose, and these things. So we do sometimes need the endocrinologist to help us with managing these babies. So it is important to be in a scenario where the glucose is supported, or labs are done when the glucose is low enough that it needs more investigation.
And how do you counsel mothers before birth to avoid these kind of problems?
Sure. So again, this is having that early prenatal care as soon as you find out is a very important step in recognizing and getting the right kind of support. So, for example, in the case of diabetes, like the preconceptional, glucose control is extremely important, and so is during pregnancy. Monitoring that the same like you would for a diabetic patient, like what are their glucoses, what is their diet, what is their hemoglobin A1C is very important, and controlling it with the right kind of medications that won't affect the fetus or baby in a detrimental manner is important, and obstetricians can follow that. So that is just an example of glucose, but there are other conditions that we were talking about throughout this session. How recognition for the various situations that can happen after birth can be recognized, avoided with prenatal care and a very close follow up with obstetricians. And there is also a specialist like maternal fetal medicine doctors, where in high risk conditions, they are also following, and they have expertise in picking up these conditions.
Mhm.
It
And
helps us formulate better plans when we have that early prenatal care, so that we know that there is a problem, we know what to anticipate, we are better prepared. So there is no such thing as good preparation, right? So having that record, having that proper history is very important for us. Maternal history is key.
Mhm. Thank you so much, Doctor. What symptoms should parents with children with neonatal hypoglycemia, what symptoms should they usually be looking out for?
So sometimes poor feeding. Okay, so poor feeding, they're lethargic, they're not waking up for feedings. Typically, babies in the first couple of days should be feeding every 2 to 3 hours, sometimes every hour, right? So if they're not, but they should be waking up. So it's not like you need to wake the baby up. They're just sleeping all the time. So baby should have that rhythm of waking up, feeding, peeing, pooping, right? So that's the basic function. So whenever that is not happening, usually you will see that there is grandmothers or aunts that are helping the mom tell, hey, why is the baby not waking up? Did you feed the baby? So when mothers are not supported, or first time parents, they don't know this. So we actually teach them. So what to expect, what is the right thing, what is the right activity level for a baby, what in what conditions should you get further support, or go to a doctor or call the doctor's office. So not waking up for feeding, not feeding well, sometimes, or they've fed better but then their feeding volumes are decreasing, the amount of urine output is decreasing, they're not stooling like before. So those are conditions that are red flags.
Mhm, mhm. Thank you so much, Doctor. And I think that brings us to the end of our session. Thank you so much for your time. I think your insights have been invaluable. Thank you so much. We appreciate it so much.
Thank you for having me.
Okay. And to everybody hearing this right now, if you want to take a consultation with Dr. Lalitha or any of our other doctors, please go on to our website, My American Doctor, or you can call us at 9914941494. Again, thank you so much for your time, Doctor.
Thank you. Bye bye.